Thanks, Sean, and good afternoon, everyone. Like Sean mentioned, my name is Taylor Edwards. I am a technical assistance provider with ICF, and today you are all on the Pilot Recovery Housing Program, RHP, Administration and Acquisition webinar, which, like Sean mentioned, is a part of the Recovery Housing Community of Practice series. As for our agenda today, we'll be covering an introduction and our learning objectives. We'll then move on to our purpose of the community of practice. Then we will have some amazing presenters to go over RHP administration and RHP acquisition, and then we'll open it up for a group discussion. So today we have our facilitators and panelists listed on this slide. You'll be joined by my colleagues, Jamie Abbott and Chuck Crimmon from ICF. And then we will have Catherine E. Blodgett and Phoenicia Favorite from the Arizona Department of Housing, and then Phoenicia is from the Louisiana Office of Community Development. They'll be sharing their experience with RHP administration and acquisition with us today. And as a reminder, just before we get any further into the presentation, if you do have any questions, please drop those in the Q&A box. Those are going to be content-related questions. If you have any logistics questions or technical issues that you need help working through, go ahead and insert those in the chat box. Our learning objectives for today are to explain how to address specific challenges faced in carrying out RHP programs, to describe best practices for reporting, working with subrecipients, and other administrative tasks, and then we will cover identifying strategies and lessons learned when acquiring property. So as for the purpose of the RHP Community of Practice, it is an exciting way for communities to access our RHP technical assistance through an online group learning and peer-to-peer collaborative approach. It also draws on the strengths of communities and their expertise in the field to foster a space that encourages resource sharing, innovative out-of-the-box thinking, and connections across RHP grantees. So a sense of community. And then will work to address specific topics with input from RHP grantees based on their unique needs and challenges they are facing in planning for and using RHP funds. And today you'll hear from Kathy and Phoenicia on exactly how they did that. So we do have a polling question. We're going to ask you guys a couple of questions, and I think Sean's going to cue that up for us just to get us started and to understand, where we're coming from here. So the polling question we have today is, what activities will your RHP program undertake? Is it acquisition, public facilities and improvements, payment of lease, rent, and utilities, rehabilitation, reconstruction, and construction, clearance and demolition, or relocation? And you should be able to choose all answers that apply, so you should be able to select more than one. It looks like we have a couple of folks who have answered. So I'm seeing we have some people who are going to undertake acquisition. So this is a very timely presentation for you all. We also have a couple folks engaged in rehabilitation, reconstruction, and construction, clearance and demolition, and then relocation. So go ahead and complete that polling question. I'll give us just a couple of more seconds. I think mostly everyone has replied. Okay, well, it looks like acquisition is going to be the most popular program that people are undertaking. So we do have some exciting information for you today. And with that being said, I will pass the presentation over to Kathy.
Good afternoon, everyone. It's actually still morning in Arizona, but but I will say good afternoon. I'm Kathy Blodgett. I am the Community Development and Revitalization Programs Administrator for the Arizona Department of Housing. I administer the state and small cities community development block grant, home housing rehabilitation, and weatherization programs with several funding sources. So RHP, because it behaves most like CDBG, and because I was the only person left at the department who had ever been in DRGR, I became elected, so to speak, to administer the recovery housing program. So I want to talk a little bit about the process we went through. So we did some pre-planning by holding some focus group listening sessions virtually. We found that a lot of the groups that attended were really looking more for operational support of their programs. And so there was quite a bit of education needed for the focus groups and the persons listening as to exactly what the RHP pilot program funds could do. And then when we explained and provided some education around that, then we were kind of able to get a little bit more information on the needs in the various areas of our state. So after those focus sessions, we really determined that we were going to need to be very flexible because we weren't certain what type of projects we were going to get in the door, because the needs seemed to be kind of all over the map, based on the group commenting. So we took a look at trying to be as flexible as possible, but gearing more towards providing housing either through acquisition or rehab reconstruction. We stayed away from payment of lease and rent type activities, and clearance and demo type of activities, because we felt it was important that whatever we did and whatever group we worked with, we would be able to see their partnerships and their wraparound services that they were providing to those persons that were in recovery. So one of the other things we needed to do is take a look at the tools that were available to us, and how we were going to collect data and do reporting. So DRGR, when I got back into it, so I had been in DRGR during NSP days. Arizona is not a state that gets a lot of that gets disaster recovery funding. So after NSP was kind of done and completed, I had not been in DRGR since that time. And so when I got in, I had a wonderful surprise at how much it had changed and what kind of information it would be looking for and putting the plan in the system. So I looked at the DRGR system, and then I looked at our particular grants management system that we used in Arizona to make sure that the data that I collect in my grants management is going to work for DRGR. And I was very fortunate that it did, because otherwise I probably would have had to do something like design some kind of spreadsheet to collect data that would eventually be input to DRGR. So after our virtual focus groups, we did a combined 2021 action plan, because we got a little over 800,000 for each year in 20 and 21. And that's not a huge impact, especially if you're a group that needs to come in or intends to come in and do some kind of construction or reconstruction type project. So we combined both years of funding. We held a webinar to introduce the funding source. We released a notice of funds availability in October of 2021. We had a lot of phone calls, but no applications were coming in the door because we found that, again, most of the groups, even though we had put in the NOFA what the funds were for, and we had held the workshop, that people were still struggling with wanting to do a project but not having sufficient support services or funding for operational services, which we couldn't do with this funding source. So the technical assistance was necessary, and it was very frequent. I probably had 2 to 3 calls a day asking about the potential for projects. So the funding challenges, of course, were there was kind of a lack of interest. Um, the very first viable application that we received was not until April 21st of 2022, so several months after we released the notice of funds availability. The viable project that came in, and the reason that I put in that we had to make extra outreach. We released the NOFA several times. We talked to groups with homeless and recovery providers and talked to them several times about the possibility of them coming in for projects. And as I said, only one viable project was received. Their initial project was going to be the purchase of a complex, not really a complex, but it was an ex sort of resort, several small cabins that persons could rent up in the White Mountains. It turned out that after trying to work through that application process, that those cabins just needed way too much rehabilitation and code compliance work to be able to make them habitable. And so that project fell through. The group that we were working with thought, well, we're done and over with, because that's the only thing we thought we were going to do. So in order to get them across the finish line, we had to go back and make a course correction. So we looked at the possibility of changing the project type with this particular applicant because they were so well connected in the community and they had partnerships that provided mentorship, that provided workforce experience, healthcare, food boxes, hygiene packs, case management. They had it all in place, and they were ready to serve people with all of those partners. And so we went back to them and provided technical assistance, and changed our project type. And so in the end, what we did was we purchased 4 single-family residences to be used as transitional housing, sober living, for up to 4 to 6 people per home, scattered site in the Pine Top Lakeside area of the White Mountains in Arizona. Because the group we were working with had tons of experience with providing services, but basically no experience in development of housing or acquiring housing, there was continued technical assistance. But all of the technical assistance that we provided, although it was getting urgent, because we were getting up close to HUD deadlines on getting commitments on the funding, it formed a really strong relationship with this particular provider. And so They had no experience doing any of the cross-cutting regulations, environmental review, you know, URA, which we had to, demonstrate that the homes that were purchased were actually voluntary acquisition and some things like that. So we did do a lot of hand holding throughout the process. And getting across the finish line was difficult because this was a funding source on top of our current workload. And as I said previously, we had those HUD deadlines that were looming. So we practiced a lot of urgent patience. So one of the things I would recommend is that early on, you want to make sure that your applicant that you're working with understands all of the federal regulations, and you may have to walk them through them several times. You may have to walk them through what you're going to need to collect as data. You're going to need to, on a consistent basis, collect that data from them. I would recommend because DRGR now is a once a year reporting on the recovery housing, you're going to be very busy. I'm sure you all manage several programs. You're going to be very busy. And if you don't find a way to collect periodic narratives and periodic performance data, you're going to get to your year end and have to get into DRGR and kind of recreate the wheel or do a lot of research back into your project management to be able to get your DRGR report done. So we had a lot of discussions on whether we would do monthly reporting, quarterly reporting, annual reporting, and we determined that because we were working with an inexperienced group, that we were going to collect monthly information from them. And a lot of the times it was just where they were in the process of the acquisition or where they were in the process of rehabbing the homes before they could be occupied. And so it was a lot of narrative, but that was good, and it helps you make sure that they're going to be moving forward when they don't really have capacity. And so you're helping them build their capacity. So we did monthly data collection. Our grants management system collects performance according to what we were going to report in DRGR, so we were lucky there. You want to make sure that when you're in DRGR that your narratives are consistent. It's consistent messaging between activities. So we wound up having 4 activities. Each one was a separate acquisition, and we just made sure that the way we said things was consistent with all of them so that it was easily understandable for your HUD rep to review. DRGR, as you know, is an annual. So just make sure that you're prepared with all the data that you need to report on your annual. Subrecipient challenges were, of course, the inexperience. So again, I did a lot of hand holding, but it was good hand holding. And they kind of have a lack of foresight of what needs to happen when. So we needed to help them through that. They have capacity issues because they have staffing shortages because they aren't staffed to be able to develop housing. That's not their forte. So they had to take a look at what type of staff they actually needed to manage the housing. They have a lot of volunteer labor. And so their capacity has to be built through the technical assistance that you provide to them, and then guiding them through their being able to staff themselves appropriately. The biggest takeaways that we had from this first applicant and the first 2 years of funding was the importance of the pre-planning. it was very, very important that we had our ducks in a row because we were going to have to really handhold. You have to get across your urgency in deadlines, but you have to do it patiently. I know it's kind of like it's like a oxymoron, or not an oxymoron. That's probably not the right word, but it's a contradictive statement. But it's I guess a kind and helpful way of expressing urgency to your applicant who has lack of capacity and experience. You have to be prepared to make course corrections. We got months down the road with our notice of funds availability and had to change course and change application and move forward doing something that we had not anticipated doing. We had to follow up all the time. There are groups that you may work with that you've worked with frequently that you don't necessarily check in with every 2 weeks because they know what they're doing, and so once a month is sufficient, or once a quarter is sufficient. With new applicants, of course, the follow-up is going to be practically weekly, just to make sure they still understand what you were asking of them and they're still moving forward and making progress. But in the end, because of that additional follow-up, because of that additional technical assistance we provided, we're able to collect the data that we need. We have formed a very, very strong partnership with this group, who is actually chomping at the bit for me to release my next notice of funds availability for my 2022-2023 funds, because it was such a positive experience that they want to go after another project. And they came out in the end performing on the project that we were able to create with flying colors. So the pre-planning, important, the urgency but patience with your applicant, important. Be nimble for course correction, have a lot of follow-up, make sure that you have the time available to be able to do all of that follow-up, because it's going to be needed. But then your partnership is going to be very, very strong. So I think, yeah, administrative questions.
Yes, this is Jamie Abbott with ICF. Wanting to remind all the participants to put in your questions that you may have for Kathy into our Q&A box. This is your opportunity to ask the expert any questions in terms of administration or with the RHP program in general. In the meantime, Kathy, so as you mentioned in your presentation, the RHP program has the grantees working with subrecipients who are not accustomed with HUD regulations.
Mm-hmm.
Do you find it helpful to have like a RHP implementation meeting with your subrecipient to go over the expectations, reporting requirements, and payment processing?
Yes. So as we worked through the process with our viable applicant, and wound up having to change course with them, we were in such constant contact with them that we actually would sit and like take our handbooks and open them up and show them, okay, so now you're going to need to do individual environmental reviews on each one of these properties, and here's the process. And so we did kind of step by step with them some of the various cross-cutting regulations they would have to pay attention to. We helped them step by step through the URA voluntary acquisition process. We had, fortunately, because we were doing the acquisition, we didn't have to do the Davis-Bacon labor standards. But yes, it was helpful as each cross-cutting regulation was going to need to be started, that we took time in our technical assistance to kind of walk the group through how it was done. And we had a lot of submissions that were, not quite there. So then we would have another call and say, okay, this is a great start. It was always, this is a great start. Here's where we need to correct some things. And each time they gained quite a bit more understanding. So I think, I had a contract specialist assigned to the RHP funding, and she was on the phone with our applicant probably at least, 2 to 4 hours a week initially, to get through all of the cross-cutting, especially. So
We did get a question come in from Cindy Deacon. Kathy, did you create an annual reporting mechanism or a similar document? And
So that's
yeah,
a
go
good
ahead.
question. That's a good question. So what we have is a performance report form that is attached as one of our contractual agreement documents, and that form is it's sent in PDF with the contract, but then also sent in Excel format so that they can actually complete it and send it in. So each month we would get at minimum a narrative on the progress. And so all those reports are collected. We keep them electronically, and then we can actually upload those into our grants management system, so that we have the narrative for each month. And there's one place for me to go when I now go into DRGR to make my annual report. The data collection as far as numbers served comes in when like one of the individual houses was complete with all of its rehab and then occupied. Then we got the data on the initial occupants of who we were serving. So again, that is part of the performance report that we designed, and also works within our grants management system. There's an outcomes, number of persons served, and it outlines what their income level is, and then what their that they're persons in recovery from substance abuse.
So
Okay.
oh, go ahead, Chuck.
Yeah, just to follow up, the other outcome of people transitioning to permanent housing, that's captured in your system as well?
Yes. So we ask them for positive, oh, now I've lost the word. Positive, well, I'll just say positive transitions into more permanent housing. But we're not quite at that point yet because we've got these transitional homes that they can stay in for up to 2 years. And
Sure,
so they've just started coming online and being occupied, but in the end, we will be getting data on those positive exits.
right. And just to make sure you've provided for that, understanding that you're still
Yes.
early in the process.
Yes.
One other question about outcomes, I guess, to follow up. Do you have other aspects of outcome evaluation that you ask the subrecipient to provide you with?
They give us like narrative on the wraparound support services that the clients are receiving. So we have that information that we're collecting as part of the narrative in the performance. And then we kind of are looking at this as if you want to equate it to like what a CDBG outcome would be, it would be access to access to housing that was not previously available. So that's kind of an overarching. I don't know if that answers your question per se, Chuck, but
Yeah. You also mentioned income tracking. Are you asking in a quantitative way to measure differences in income at entry and exit?
Yes.
Or
Not at exit, but just at entry.
Okay.
What the incomes are at entry, which is usually like nothing because they're coming out of not being employed, but
right. But you're not trying to chart how the services provided result in an increase in their income.
no.
Probably any income is an increase, is what you're saying.
Yes. Yes.
But that's not a reported outcome.
No, it is not a reported outcome.
Okay.
Well, thank you, Kathy. At this time, I think it would be,
Well, we got one more question.
well, we
And maybe
do.
yeah, I don't know. Sandra has a question about acquiring a property, and maybe we need to move this to Phoenicia's Louisiana presentation, but a question about acquiring a public property declared a public nuisance and convert it into affordable housing.
Uh,
Do you
I
want to
don't,
have Kathy respond, or do you want to wait? We got your question, Sandra. Thank you.
I'm hoping that I'm not speaking out of turn, but if there is sufficient funding to address all of the concerns of the property, and you have support of whatever community it's in that they are going to accept the rehabilitation or the reconstruction. I mean, because demolition is, like if you wanted to demolish and construct something new there, that's a possibility. Or, if it's savable, I think there's mechanisms for that, but probably financially, depending on how much recovery housing you may need additional funding sources to undertake a project of that magnitude. But it
Yeah, and
should
we could probably
be
bring that question back up in our group discussion later
right.
because there might be some other nuances that we may need to think about, such as federal fund or CDBG funds. Even though this is recovery housing program, but CDBG
Right.
funds in general can't be used on projects with eminent domain. So that might, there's little nuances that may need to think
Yeah.
about and may need to further discuss later on in our presentation.
Good
Yeah,
point,
and
Jamie.
maybe
Good point.
the questioner can expand on what is meant by a public nuisance and the extent of rehab that they're proposing to tackle.
Yes.
Right.
Yeah.
Okay. Well, thank you, Kathy. If we could go ahead.
Yes, I
Okay, thank you
am
so
going
much.
to transition the ball to Phoenicia and make Phoenicia the presenter. And thanks, everyone.
Good afternoon, everyone. My name is Phoenicia Favorite, and I am the Policy and Program Coordinator here at the Office of Community Development, Local Government Assistance Section for the state of Louisiana. Here I assist in the planning and reporting for the LCDBG program, LCDBG CV program, EPA funded programs, and the Recovery Housing Program. So today I'll take you through the steps OCD took to acquire properties for the RHP program. So in Louisiana, we received our first recovery housing allocation in FY20, and which, as we all remember, was also during the height of the pandemic. So in our office, we handled the state CDBG CARES funds also. So the initial setup of the RHP program was delayed a little. So after reading the program requirements, we decided that the best source of information would be from the Louisiana Department of Health, which is also known as LDH. We scheduled several different meetings with LDH's Office of Behavioral Health, where we discussed the statistics from different areas of the state based on drug-related data. We familiarized LDH's department with our focus and what the program requirements were. And they also formulated a list of areas with the greatest need of services based on that information. This data was also incorporated into our action plan. So the next step was for us to formulate our notice of funding availability. And this was published and sent directly to some of LDH's identified providers. The NOFA was also included the area of greatest need as one of our priorities. And this came from LDH's statistical data. The total funding availability for that NOFA included both FY20 and FY21 funds in the amount of $1.475 million. So we published the NOFA and the deadline came around and we didn't receive any responses. We then came up with a possible reason that this is a new federal program that the nonprofit organizations were not familiar with. So we got back with LDH and we met with them, and LDH and OCD reached out directly to some of the nonprofit organizations to explain the funds, how much was available, and what the funds could be used for. We then redistributed the NOFA by email directly to the partners that were interested, and we received more feedback the second time around. At the end of the process, OCD identified the nonprofit Odyssey House as the organization that best aligned with the program's priorities, and they were invited to submit a full application to the program. So Odyssey House is a nonprofit organization located in New Orleans Parish, and they were ranked second in need, and it's also in close proximity to the area of greatest need. Odyssey House Louisiana provides holistic and client-centered services in a safe environment that addresses the full continuum of special care needs for the state of Louisiana. Odyssey House empowers individuals to become active participants in their treatment and recovery to reclaim functional and productive lives. So this chart shows the continuum of care for Odyssey House. This includes detox, treatment, case management, skills, behavioral and medical health care, and counseling. So Odyssey House applied for funding to acquire 2 homes in the greater New Orleans area that could be used to increase the number of beds available for substance abuse recovery in Louisiana. OCD awarded Odyssey House on August 8th of 2022 a large portion of the FY20 and FY21 funds in the amount of $1.377 million. This award was contingent on the approval of the action plan by HUD and other contract conditions. So Odyssey House was funded under the acquisition activity only. OCD did not cover any costs related to the administration of this project, and this enabled the organization to get started on their ERR process prior to our authorization to incur costs. So there were several different challenges that pushed the closing date of both properties back. The sellers were in constant contact with both OCD and Odyssey House staff. Some challenges included delays in the environmental review process due to the staff carrying out the administration. For the staff, this was their first time completing an environmental review on their own. They've been funded by different federal programs, but they had never completed the environmental themselves. And also, yearly internal budget changes within the Louisiana Office of Financial Support caused a second delay. The sellers were very anxious to close, and they were not happy with the closing dates being moved twice. So the second time, they required a memo from OCD stating that the funds were available and the reasons for the delay prior to them signing the second extension. So Odyssey House was able to close on both properties on November 9th of 2022, and our 30% expenditure deadline for the state was November 16th, 2022. So we made that deadline very close. Between both locations, the organization now has 20 new beds available. One location is open and currently has residents, and the second location is scheduled to have residents move in the first week of October. So this home here is the Miro Street location. The home is located at 216 North Miro Street in New Orleans, Louisiana. The maximum capacity is 10 residents, and they currently have 6 residents in the program. This is the second location. This home is located at 3305 Dumaine Street in New Orleans, and the maximum capacity is also 10 residents, and it is move-in week for the residents entering the program at this location. Now we can take acquisition questions.
Thanks, Venetia. So you mentioned it's move-in week for the second location. I'm just curious, do you know how many residents are going to be moving in?
They're doing staggered entrance. So the first one, there's only 6 people there now. They moved in, I want to say 2 months ago, and then they're going to add more people. The first week in October, they'll add the other 4 people. So he said that they do it like that when they first start a new home. Just at the beginning, they'll only move about 5 or 6 in, and then they'll move the full capacity as they can.
Okay, great. Just want to take a moment to remind all the participants to enter in any questions they may have to Venetia for challenges with acquiring properties, or some barriers, or any questions that you may have on acquisition in general. Venetia, your presentation went into great detail of the challenges that your department faced in administering the program. What would be some of the ways that you would accelerate the environmental review process if you were to do it all over again? What would be some steps or actions that you would implement if you had to do it again?
So throughout the environmental process, we worked closely with the grant administrator for Odyssey House, and it required a lot of technical assistance. And so I actually sent him an internal checklist that we use whenever the environmental reviews come in. And we also have a grantee handbook that outlines exactly how the letters, the correspondences that are sent out should look. And it also gives them the websites that they need to access to get the information that they need to submit with the environmental review. So I think that worked well because they were able to actually see what they needed to do. And I kind of held their hand and gave them everything that they needed up front with examples.
And that's very helpful to have examples. Did your project include an option agreement for purchasing the property, or were those sellers understanding that there was steps that had to be taken prior to the purchase? I know there was multiple delays because of the fiscal year end and other items that you had noted, but essentially were the sellers understandable outside of that?
Right, there was an agreement in place and it had to be extended several times, and that's where the anxiousness came in, because they had a certain date on that agreement, and once it had to be extended for those reasons, they wanted to ensure that the sale would actually happen and they wouldn't have any more delays, which we couldn't say 100% there wouldn't be any delays, but we could tell them that the money was there and it is available once everything is cleared.
So finish. You used a conditional contract, a contract with certain stipulations and conditions that had to be met, rather than just an option agreement. Is that an accurate description of what you went through?
I'm not 100% sure which agreement it was, but I can find out and let you know.
Great. Chuck, do we have any questions in the Q&A box?
Nothing has popped up. Just a quick question. Were the sellers investor owners or owner occupants, or who were you dealing with in terms of the acquisition?
I think it was owner occupants for both properties.
Okay.
Okay. Well, there is ample time for all the participants to put in their questions in the QA box. We will have a group discussion here in just a few moments. But for now, Venetia, I thank you for your presentation. It was.
Let me just chime in one more time. Finish on the environmental aspect, just to go back to that for a moment. Was part of the delay that it was just the first time they had ever done this, so that there's some inherent challenges in getting through that kind of process when one had never done it before, and that, for example, if you worked again with Odyssey House, they'd feel more comfortable and be able to complete it in a relatively more quickly than they did the first time.
Correct. So we actually just awarded our FY22 funds, and they were actually awarded to Odyssey House as well. They reapplied and they did acquisition this time as well. And the process went a lot more smoother. He was familiar with it. He knew what was expected. And he actually started the process prior to me having to tell him what to do. So I think it works better the second time around.
That's a positive outcome.
Yes.
Yeah. So that's inherently the first, no matter how much TA you provide, the first time is sort of, getting your toes in the water and going, step by step, and having to check back probably every time they took another piece of data was gathered. Is this adequate? Is this what you want?
Yes, it was a lot of sending. Is this right? Is this? And I would email them back and let them know if it was sufficient or not.
Yeah, and each step took, it took time. Okay. Any other questions in the Q&A?
None that I see.
Hi, everyone. This is Corey Schwartz from HUD. Maybe while people are thinking of their questions, we can go back to Sandra's question earlier about acquiring property declared a public nuisance and converting it into affordable housing. So thank you, Kathy, by the way, for jumping in and answering a question for us. Yeah, you can acquire property declared a public nuisance. The term public nuisance kind of implies code enforcement or code violations. So you can't use RHP funds for code enforcement work. But if you are going to, if there is a property with that's been declared a nuisance, or that has sort of code violation, RHP funds can be used to acquire that property and rehab it to take care of that nuisance or code violation and provide housing for persons in recovery from substance use disorders. There's also a mention about eminent domain. The eminent domain prohibition is on property taken through eminent domain and then used for economic development purposes. So that same restriction doesn't apply here. But obviously, if you are going to use eminent domain to acquire property, obviously check with your local council to make sure that any action through eminent domain is legal. But kind of going back to the question, yeah, you can acquire property and then take care of any sort of code violation or issue and make that into housing for persons in recovery.
Yeah, if the questioner wants to expand on the public nuisance, because in some cases a public nuisance could mean just loud music, and the occupants were playing their stereos, their music too loud, or maybe it was occupied by a rock band. Who knows? But it could mean those kinds of public nuisances, as well as some issues of physical deterioration that had to be addressed.
Great. Thank you, Corey.
Sandra, let's see. Uh,
Okay, so it
Sandra,
looks like
I saw for a moment something appear, and I don't see your entry again. So
okay.
maybe Sandra, do
Yeah,
we
so I
want to
see
hear Sandra?
there's a lot in that might be rebuilt for affordable recovery housing. So if the community wants to use RHP funds to acquire and rehab that property, that is a certainly viable option.
Thank you, Sandra, for that additional information. A lot of communities are facing, I guess you could say, more as a slum area issues where there is multiple houses in a general area that are a nuisance, and so sounds like it is a quite possibility that it would work as long as it is meeting the LMC low moderate clientele national objective for the recovery housing program for serving individuals with substance use disorder. So with that, this is a time that we're going to have a group discussion. Encourage all the participants to raise their hand to maybe come off mute and ask some questions, and or adding questions within the Q&A or the chat box for our presenters, Kathy with the state of Arizona and Phoenicia with the state of Louisiana on their RHP program. But while we're thinking about what kind of questions we could be addressing or discussing, I want to ask in general, in developing additional outcome measures, has anyone approached these additional outcome measures in a reverse engineering mode by looking at an existing data gathering system, such as the homeless management information system, the HMIS, as a lot of folks call it, and consider what data is already being collected for the RHP participants that could be extracted to provide another useful outcome indicator for the program?
Any bites at that apple?
Yes.
Somebody want to raise their hand? Yeah, the thought was that rather than so, I want to measure this and let's create a new system to measure this. Just sort of thinking, all right, what am I already collecting, and how could I extract that to come up with a useful indicator of outcomes? I know HMIS is pretty comprehensive, so there's a lot of data fields that you might want to look into and see what jurisdiction might come up with as an outcome measure. I think trying to remember, I haven't delved too deeply into HMIS, but I did recall in reviewing that Connecticut, which is participating with I don't know if Connecticut is online today, but I recall that Connecticut is managing this program through coordination with its continuums or continua of care. I don't know how you want to. Perhaps some others have worked through the continuum of care organizations in your state and the district. I don't know if the district is on. We have to keep reminding ourselves that we do have states and the District of Columbia as RHP grantees. All right, Jamie, what else?
All right. We'll go on to maybe hopefully an easier question for everyone out there, all the participants. What are some of the barriers you all had to overcome with the RHP funding? You know, RHP funding kind of came out at the, you know, the start of the pandemic. So, you know, what kind of effects or barriers did everyone have to overcome, or what are some barriers that that you're facing now? Once again, you can use your raise a hand feature to come off mute. You could respond in the chat. I see Cindy. Thank you, Cindy. Nonprofit capacity. So assuming that, you know, with the RHP funding, you're having to work with subrecipients who are not familiar with the HUD cross-cutting requirements. Or, you know, maybe a step further, the nonprofits were also having to deal with staffing overturn and having all new staff. Kathy, I see you got
Yes,
your hand raised.
I do. Because one of the interesting barriers for us was that we had staffing challenges. We are an agency of the state that runs very lean as far as staffing is concerned. And when the pandemic hit, and RHP wasn't from the pandemic, but we had the RHP funds and we had the CDBG-CV funds and we had, you know, all these huge amounts of funding sources, and, you know, dropping all of that additional work on our own staff became a tough management issue.
Yeah, competing
So,
priorities, right?
yes, exactly.
I call that my plate overfloweth syndrome.
Yes. Yes.
Yes. And each set of funds had their own deadlines and
Their own deadlines, their own, yes, and their own activity.
their own nuances that
Yep,
you had to
there's
click.
nuances that you had to figure out, and, you know, whether or not we could try and figure out how to do projects that weren't going to have as much cross-cutting federal, or, you know, were we going to try to do these projects without dumping other funding sources in that would cause other complications. So yeah, it was a challenge.
Kathy, if you don't mind me asking, do you find that all that has kind of slowed down for
No.
Arizona? No.
No. No. We have had a lot of other things occur. So my division also got some of we shortened it to SFRF, but the state and local fiscal recovery. So we got that added on top again. And then we've had an unprecedented amount of state housing trust funds that have been awarded to our agency. So that's a whole nother group of like 3 or 4 different programs that we're, you know, trying to incorporate into everything we do. So yeah, so some legislative agenda added into the mix.
Wow.
So,
And I'm sure you're not the only one, since probably all of our RHP grantees are
yes.
experiencing the same.
Yes. And there just aren't enough hours in the day. And so we are now a 100% remote workforce. And I think, you know, we'll probably never go back to being in the office full time because they get way more work out of us being remote. Because we're willing to stay home and work till all hours of the evening.
And then are you all hiring additional staff? And then,
No,
no?
no,
Oh.
I don't. Yeah. And so I've got, you know, additional extra funding from the bill from the Department of Energy, and now we're looking at the rebate program, and so there's all this funding that just keeps coming states ways, and it's quite a lot to tackle.
Wow. Okay, well, we'll go ahead and go on to another question here. That has anyone considered funding an acquisition activity but decided not to because you or your subrecipient were intimidated by the challenges of acquisition and relocation requirements? So I feel like Sandra, she put in a question in earlier. It looks like she's contemplating acquisition. You know, Sandra, if you want to or anyone else is welcome to, in the chat or in the Q&A box, to you know, answer that question about you know, acquisition fears, or you can use the raise a hand function to come off mute. I know that acquisition can be a bit daunting with the relocation requirements, Chuck.
Right. And certainly working with owner occupants who are voluntary sellers, you know, is one aspect. And of course, you have to establish that. You still have to go through a process of making a fair offer based on your assessment of the appropriate price of the property, fair market value. But a willing seller has a unit on the market as an owner occupant. That does simplify. And it sounds like most of the folks who have done this acquisition have gone that route. They have willing sellers who are owner occupants, and you're sidestepping any obligation to provide relocation benefits. Sandra, another comment. I saw some reason my
Yeah, I have it here, Chuck.
yeah.
Yeah, Sandra is very interested in receiving more information about this program. Would you please send me a link to review the information? So it sounds like Sandra may be with a nonprofit organization. So Sandra would need to contact your the state that you're in. Would need to contact your state grantee for the RHP program, but we can definitely take a look and provide that information, which it is available. Oh, you are local government. I apologize.
Gotcha.
Yeah.
So, yeah. The other reference I would say is at HUD.gov, the acquisition relocation section under community planning and development is a good source, as well as the HUD Exchange. There's lots of online information available, and there's certainly a place to start. Each of the HUD field offices, not each field office, but there's a network of specialists in acquisition and relocation that serve each area. I don't think they have, I don't know how many, 41 or 42 field offices now. I think there's a network about 8 or 10 specialists in acquisition, but there's one identified to serve your jurisdiction, your state, your area. So they're an additional online source. There is, I think the other thing we'd mention, HUD has provided an on-call technical assistance availability for the RHP program, and through the website, through the RHP section on the website, in coordination with your field office, you can submit a request. You want to make sure your field office is involved and aware of the issue and what you're doing, but you can submit a request for on-call technical assistance, which our HUD colleagues would review and authorize, and we'd identify an appropriate expert in that area if it's acquisition and relocation, or what other appropriate subject areas, and provide you with a direct on-call technical assistance resource provider. So
Yes. Chuck, yeah, I do have that information up on the screen.
good.
So
Thank you.
we encourage the grantees to contact their HUD representative to have that beginning discussion of you know, needing the technical assistance, because when requesting technical assistance through the HUD Exchange webpage, your HUD field office will receive the notification or the request. So it's best to go ahead and have your HUD field office kind of on the same page. And when requesting the technical assistance, need to make sure that you're really detailed as to what areas you're needing technical assistance with. So, you know, being as thorough as you can in your description for submitting technical assistance would expedite the request process. And if approved by the HUD field office, you'll be contacted by a subject matter expert or technical consulting firm to work through your needs for the recovery housing program.
Yeah,
But-
we're looking for something specific in scope, just like, you want specific outcomes from your subrecipients and so forth. The technical assistance needs to be more specific than I need help. So, what's the area specifically that you're looking help on, and what's going to happen, what's going to be achieved as a result of that technical assistance, so that HUD could be confident that in authorizing that expenditure that we're going to have an appropriate outcome and result to achieve.
Yeah. Real quick, for all the participants online today, we are looking to hold more community of practices, and so we're talking about future technical assistance needs. In the chat or in the Q&A box, if you could put your answer or responses to what topics would you find most beneficial to receive technical assistance on in the coming year? Or, what would be some good community of practices topics that we could present in the coming year as well? Feel free to enter that information in, and so we can capture and take it under consideration.
I don't want to preempt anybody, but I'm betting DRGR refreshers, rehab, labor relations. Cindy?
Yep, rehab and labor standards.
Yeah.
Labor standards is always good to have refreshers on.
Yeah, and our HUD folks maybe would want to emphasize the exemption for a single unit rehab or up to 7 unit work on residential properties, and affirm that I guess that same labor standards exemption that applies to CDBG is applicable to RHP, since we're based on the CDBG regulations.
And continue entering in your suggestions in the chat. Once again, want to touch on request a program assistance. That could be done through the HUD Exchange website. And with that, would like to thank everyone for attending today's Community of Practice. And you can visit the RHP page on the HUD Exchange for additional program information, including within on the HUD Exchange, you can do a search for other cross-cutting areas such as the uniform relocation, labor standards, and rehabilitation requirements that would be part of the RHP program.
Yeah, and that's where you'll find our existing material that has been recorded and posted on the RHP for other topics, including DRGR. So you can find that there. You may not want to listen to the entire recording, but going through the slides, refamiliarizing yourself with some of the main points that were made in those presentations. There are also implementation webinars and discussions of the action plan. So there's quite a bit of information. I did notice, and Jamie, did you get, I think it was something from SAMHSA, the Substance Abuse and Mental Health Services Administration, best practices on recovery housing.
Yes, that
recently
has
came
been
out?
posted. Yes, that has been posted to the RHP page on the HUD Exchange. But yes, SAMHSA has recently released a document, and HUD has posted it onto the webpage as it would be beneficial, potentially beneficial to the grantees.
All right.
Great. Well, thank you, everyone. And for attending today's community of practice. This concludes our session.
Thank you.
Thank you.
Good luck.